It's so easy for us in environmental health to be like, well, you're doomed. You're exposed to all these things, right? But being able to say, yeah, a lot of chemicals are not good for you, but this is how you can change your trajectory. That's huge.
Welcome to Collaborative Endeavors, a podcast about how experts from different areas of research come together to tackle big health challenges, leading to better therapies and healthier communities. In this episode, we meet Dr. Julia Anglen Bauer, an assistant professor in the Department of Epidemiology and Biostatistics in UIC School of Public Health. After pursuing an undergraduate degree in biomedical sciences and working in a molecular neuroscience laboratory, Dr. Bauer was connected with an epidemiologist who laid the foundation of her passion for medicine at the intersection of culture. This eventually led to a career examining how environmental exposure impacts neurological outcomes across the lifespan. Now, as a CCTS-KL2 scholar, Dr. Bauer is taking a deeper look at how levels of pollutants stored in the body can predict Alzheimer's risk decades before symptoms set in, with a specific focus on the U.S. Latinx population.
What started my career as an epidemiologist was having this small project on lead exposure in children in Wayne County, Michigan. And it really built the foundation for all of my work that I have done since. I went to UIC for my MS, and I wrote a master's thesis on this work looking at urinary mercury and risk of multiple sclerosis. I really decided I wanted to be a leader in science and knew I had to get a PhD. So I applied, and I was fortunate enough to get into Boston University School of Public Health, and I got a PhD in environmental health. So really my doctoral work and my postdoctoral work that I did at Dartmouth focused on kids' exposures, things like manganese in drinking water, arsenic in drinking water. And that brought me back to UIC, actually. It just feels like coming home, honestly, because I know so many of the faculty, and I just feel like I was really able to integrate into research here and make an impact. So I'm really excited to be at UIC and to really honored to have this opportunity for the KL2 to do some more training, which is all about Alzheimer's disease. What I'm looking at now is there's this really long latency between when pathology of neurodegeneration starts and when someone is diagnosed with Alzheimer's disease. And so a lot of the cohorts looking at neurodegeneration, they start when people are already diagnosed. And it's tough because there's not a cure for Alzheimer's disease yet, right? And without effective treatments, there's an urgent need for research targeting modifiable risk factors during early stages of disease. And the pathological hallmark of AD is the abnormal aggregation of amyloid beta, which you may have heard about. And this aggregation of amyloid beta really initiates a cascade of pathological events that leads to signs of Alzheimer's disease decades later. So exposure to neurotoxicants across the life course can remain in the body for a long time. This is true of things like persistent organic pollutants, which is what my work is about now. It's kind of a long word, but we call it POPs in the environmental health field. Things like DDT, lots of different organochlorine pesticides, things like industrial chemicals that are called polychlorinated biphenyls, and they accumulate in our body, especially in fat tissue. We can measure these stored chemicals in the body, and they stay in our body so long that we're really able to estimate exposure decades before Alzheimer's disease even occurs. So if I take a blood sample from someone, we can say that exposure occurred on average, 10 to 20 years before we're taking that sample. So it really allows us to think about the relationship of these persistent chemicals and how they may be related to Alzheimer's disease. The overall goal of this project is to investigate the relationship between exposure to these persistent organic pollutants and Alzheimer's disease biomarkers among racially diverse Latinx communities in the United States.
Approximately 7 million people in the United States are currently living with Alzheimer's disease, and this number is projected to nearly double by 2060. The Latinx community faces an even higher risk of developing the disease. Dr. Bauer highlighted the significant extent of these disparities.
So we're talking about double, maybe even triple for some people. Compared to older non-Latinx whites, Latinos have a higher risk of Alzheimer's disease, and prevalence is expected to increase by 800% by 2060. And we don't really know why there is a disproportionate burden, but it may involve, the increased prevalence of cardiometabolic conditions such as diabetes and obesity in the Latino community, as well as other modifiable risk factors that may include exposure to environmental contaminants through diet and occupation. In general, what you find in environmental health research is the people that are most affected are the people that have have a higher risk of social determinants of health. So things like being an ethnic minority, having lower socioeconomic status, things like this can really contribute to their environmental health burden. And you also have to think about, people that come here from other countries. Other countries, in Latin America, they've had different exposure scenarios than the United States. They've had pesticides that were in commerce longer than we did, for example, such as DDT. So it's definitely something that we need to consider in terms of how we treat our Latino patients that are aging.
An ongoing study at UIC, the Hispanic Community Health Study, or Study of Latinos, led locally by Dr. Martha DeViglis, is helping power Dr. Bauer's research on this community. You can find additional information about this study and Dr. DeViglis in the show notes.
It's the largest health study of Latinos in the United States. It spans San Diego, Chicago, the Bronx, and Miami. And within this large study, they're really able to capture the experience of a diverse, rich history of Latinos across the United States. And the study that I'm able to use, it's really looking at these persistent organic pollutants and endogenous hormones. And there's another study in San Diego that I reached out to that have done an incredible amount of neurocognitive and brain imaging work. How I developed my idea is to really, put two of these ancillary studies together and think about how these persistent organic pollutants impact neurodegeneration with both brain images and then blood tests for these different hallmarks of Alzheimer's disease.
As stated early on, there is no cure for Alzheimer's disease, and without robust therapeutics, millions of individuals and their families will continue to suffer both physically and emotionally. Dr. Bauer explained how this research might pave the way for preventative strategies or early interventions that could be used before symptoms manifest.
With this kind of research, we're thinking about not only primary prevention, but secondary prevention. I mean, you could do dietary interventions. These kinds of chemicals, they're in meat products, they're in dairy. Simply changing diet could be helpful. Doing some intervention work like that, I think in the long term would be really impactful and rewarding. It's so easy for us in environmental health to be like, well, you're doomed. You're exposed to all these things, right? It's not, environmental health scientists are the people that you don't want to take to lunch, right? Like we're going to tell you 1,000 ways why you're going to die and from different things that you eat. But being able to say, yeah, a lot of chemicals are not good for you, but this is how you can change your trajectory. That's huge. It's so powerful to your health and empowering to individuals.
A highlight of the KL2 award is the extensive mentoring support provided to the junior faculty. Dr. Bauer described her mentor team and how they're helping her develop as a translational scientist.
So I'm really thankful to have so many incredible scientists on this mentoring team. They are all like in their own right, really doing incredible things in their own field. And I think they're going to complement one another in terms of how they mentor me specifically and what they'll bring to the research that I'm working on. So my primary mentor is Mary Turek. She's a professor in epidemiology and biostatistics, and she's really brings a wealth of knowledge of the persistent organic pollutants measurement and environmental epidemiology research. She's really dedicated her career to measuring persistent organic pollutants in a variety of different communities, as well as metals. My co-mentor is Orly Lazaroff. So she is a amazing professor of neuroscience in the Department of Anatomy and Cell Biology at the University of Illinois Chicago. And she's also the director of an NIA-funded T32 program that's really training in the biology and translational research on Alzheimer's disease and related dementia. I could talk about her forever. Well, what she really adds is this animal model piece and understanding the pathogenesis of Alzheimer's disease. I mean, she's a pioneer in the field of neurogenesis in Alzheimer's disease. Dr. Rob Sargis, he's really focused on persistent organic pollutants and metals and thinking about this from a translational perspective, both in animals and clinical outcomes. And so having him on the team really adds a lot about thinking about how to improve human health and crossing the bridge between animal and human studies. One person that is going to be playing a pivotal role in my mentorship is David Bennett. He's the director of the Rush Alzheimer's Disease Center. He has several different human cohorts on Alzheimer's disease in the Chicago area and then also in Brazil.
Rounding out Dr. Bauer's team is Dr. Mark Weiskopf, a professor in the Department of Environmental Health and Occupation Sciences at Harvard University.
I've known Mark for a long time. He's served as a collaborator before in the research that I did at Dartmouth. So he does work that's really, spans the life course, which is what I'm getting at as well. He has work in looking at environmental risk factors for autism. In Israel, he has work in different like mixed metals exposure in minors and ALS. So really this spanning this work from neurodevelopment to neurodegeneration, and he's trained as an environmental epidemiologist as well as he has a PhD as well in neuroscience. So for me, he's training me in a way that I think will give me foresight into how I want to lay out my career specifically. The kinds of skill sets that an environmental epidemiologist can have. I can't do it all. And I realize that I need collaborators, right? And hopefully my mentors will be my lifelong collaborators in this endeavor.
Dr. Bauer spoke to the unique nature of environmental toxicology and how this study hopes to identify and share models that can help other researchers draw associations across complex chemical and biological data sets.
I think there's a lot of ways that this work can be built upon, thinking about environmental mixtures and thinking about, not just persistent organic pollutants, which are very complicated, like the kinds of models that we're going to be using are some of them will be quite novel and allow you to compare associations across very correlated data because we're not in a bubble, right? In the real world, we're exposed to thousands of chemicals. And how do we account for that? How do we think about that? It's an area that's very exciting in the environmental health field. So I think in that regard, people could use this work to they could use the models that I'll be publishing on to think about different mixtures of exposures. It could be, it wouldn't even necessarily have to be environmental health exposures. They could be something like multiple proteins that you measure in blood.
As our conversation neared its conclusion, Dr. Bauer shares some thoughts on the trajectory of her research career and ways in which she would like to make an impact on our communities.
This really set the foundation for my mission to uncover critical windows of environmental exposures that impact neurodevelopment. And now I'm going to be going into early markers of neurological disease and thinking about the interface between exposures in the environment and the human body is dynamic across life stages. I feel like this work that I'm doing will really impact Alzheimer's disease risk and lay the foundation for thinking about midlife as a critical window for Alzheimer's disease pathology. I see this project as being the foundation for my career. With this particular project, it's really linking the environment and neurodegeneration in a community that I, want to work in. I see my work going into really thinking about gene environment interactions. So thinking about, people that are at a higher genetic susceptibility to diseases and how environmental exposures can really enhance disease trajectories in these susceptible individuals. And I want to really work with people that have environmental justice concerns, people that this work is really impactful in their lives. Being able to change, not only just think about the pathological mechanisms, right? That we've been talking about in terms of, blood markers and chemicals, but also how to help communities live healthier lives. And maybe that looks like working more with people that do community translation work and being able to really clean up communities that need help that maybe are overlooked, right? They don't have the resources that others have, and really making a difference for people across life, from kids all the way through the elderly.
Collaborative Endeavors is written and produced by me, Lauren Rieger, on behalf of the Center for Clinical and Translational Science, aka the CCTS, at the University of Illinois, Chicago. To learn more about Dr. Julia Bauer and the CCTS's KL2 CATS and CATS affiliate program, visit the links in our show notes. The CCTS is supported by the National Institutes of Health National Center for Advancing Translational Science through their Clinical and Translational Science Award. Opinions expressed by guests of the show are their own and do not necessarily represent the views of myself, the CCTS, or our funding agencies. You can find more episodes of Collaborative Endeavors on Apple Podcasts, Spotify, Amazon Music, Pandora, and YouTube. While we do not monetize this podcast, we do love positive feedback. If you like what you hear, go ahead and give us a 5-star rating to help spread the word. To learn more about how you can work with the CCTS to make a positive impact on the health and well-being of our community, visit ccts.uic.edu or follow us on X at UICCCTS.
Welcome to Community Level, a podcast where public health research meets real-world impact. Brought to you by the Community Health Sciences Division of the University of Illinois Chicago School of Public Health. I'm Dr. Kelechi Bay-Lamberts, your host, and each month we'll bring you in-depth interviews with leading academic researchers, community leaders, and organizations making a difference in our communities. Discover the groundbreaking projects and innovative solutions that are shaping the future of public health. Your personal stories and professional journeys that led these experts and community leaders and scholars and students to their vital work. At Community Level, we go beyond the data to explore the human side of public health research and community initiatives. Whether you're a student, professional, or just passionate about making a difference, this podcast is for you. Join us as we bridge the gap between research and practice, one episode at a time. Subscribe now on your favorite podcast platform and follow us on social media for the latest updates. Let's make a positive impact together at the community level.